Hello, welcome. This is Mrs. Ignacio, and I'm going to go through a next generation style case study for you with a maternity patient. So, the nurse is caring for a client admitted to the labor and delivery unit at 35 weeks gestation with preeclampsia. So, as we go through this case study, I want you to paint a picture of a patient that you are going to walk in and you are getting report on this patient. So we're going to click to highlight the 4 findings that are most significant. So let's kind of zoom in and take a look at this report that we have. Whenever you have these next generation cases, you want to read every tab. As we go through these case studies, there's going to be 6 questions that are associated with each of the cases. So you'll have 3 separate cases. Each of them will have 6 questions. And that is the style for next generation. So let's take a look at the admission note. At 8:45 in the morning, the client, who's 29 years old, prima gravida, meaning that this is her first time having a pregnancy at 35 weeks gestation, admitted with severe preeclampsia. So she's not quite to full term because she's 35 weeks. Full term is 37 weeks. Severe preeclampsia. So I'm thinking that her blood pressure is very elevated. She has protein in her urine, right? She hasn't had a seizure yet because if she had a seizure, then it would be eclampsia. Plan is magnesium sulfate for 24 hours followed by induction of labor. So magnesium sulfate, we've talked about that in class, and we know that magnesium sulfate is a tocolytic. It's also given to bring down the patient's blood pressure with preeclampsia. Okay, so let's look at our flow sheet. And so we have time 9, 10, 11, and 12. So it looks like every hour we are monitoring this patient, which makes sense because she is, not a stable patient. All right, so magnesium sulfate dose was given 4 milligrams at 9. Reflexes were present, and that's great because remember, with magnesium sulfate administration, we want to look out for deep tendon reflexes. We want to look out for respiratory status because if things start going really, really slow, we are going to get concerned. So the blood pressure was 159/89 at 9 o'clock. Heart rate is 72, respirations 18, pulse ox is 99 on room air. The urine output is 35 mLs. Remember, 30 mLs per hour is what we want for our patients, okay? If there's less than 30 mLs of urine per hour, we're starting to get concerned. And that's something that you're probably going to also touch upon in med-surg, but that is an NCLEX concept that you need to know. 30 mLs of urine per hour for every patient that is not on dialysis, right? Not a kidney patient. Other drugs or observations, none. So that's what's happening at 9 o'clock. At 10 o'clock, we've got 2 grams of magnesium sulfate. We do have our deep tendon reflexes. They're +2, which is great. The blood pressure is coming down. So 139/84. The heart rate is 71. Respirations 18. 99% oxygen on room air. Okay. Urine output is 30 mLs. And so there's nausea now. Okay, so now let's look at what's happening at 11 o'clock. Okay, so 11 o'clock, 2 grams of mag sulfate is given. We still have deep tendon reflexes at +2. Blood pressure is still coming down, 131/85. Heart rate is 72. And respirations 17. Pulse ox is 98% on room air. Urine output is 30 mLs. Now we have nausea, cutaneous flushing, and we have sweating. Now, one of the potential side effects of magnesium sulfate is that feeling of warmth, of flushing and sweating, and that's one of the expected kind of side effects, okay? Let's take a look at what's going on at 12 o'clock. 2 grams of mag sulfate given. Reflexes present? No. Whoa, wait a minute, that's a significant change. That's not painting a good picture because I know as a good nurse, I'm looking out for magnesium toxicity. The fact that they don't have reflexes is very concerning to me. The blood pressure has come down to 109/72. but the heart rate has gone up to 102. That's not very reassuring to me. I'm a little concerned about this now, okay? Now I'm looking at the pulse ox is 92% on room air. Okay, I don't like the fact that the oxygen has gone down that much. Okay, urine output is 20 mLs per hour. Okay, that is cause for concern because remember that magic number is 30 mLs per hour. So I'm concerned about their kidney function. Okay, their ability to make urine. And now we have a shortness of breath. Okay, whenever any patient has a shortness of breath, that's something to take seriously. We have to figure out why. We have to, pay some attention to that. Okay, so looking at the flow sheet, this is what's happening 9, 10, 11, and 12 o'clock. All right, let's look at the 900 note. 4 grams loading dose magnesium sulfate IV started. A loading dose is going to be a large dose. It's given one time, and that's to initiate the patient on the medication. So it's not always given, but in this case, the loading dose is given and it's 4 grams. So this is going to be run over 20 minutes. The second nurse verified the pump settings. So this medication, magnesium sulfate, like heparin, like insulin, is a 2-nurse check. Okay, so the client educated on the medication and the side effects. Client complains of headache, rated 7 out of 10. No nausea, vomiting, no epigastric pain, no visual disturbances. Current BP 159/89. Fetal monitor shows baseline heart rate at 130 beats per minute. So that's reassuring. Moderate variability, accelerations present, decelerations absent. So that's reassuring that the fetus is doing well. Okay, that they're doing okay, the fetus. So at 920, magnesium sulfate loading dose complete. Magnesium rate changed to 2 grams per hour, continuous infusions. Second nurse verified pump settings. Okay, so far so good. 11, client noted to have cutaneous flushing and sweating. Fan brought to bedside. That's good, good nursing intervention. 12 o'clock, absent patellar reflex. So think of your patella, that's your knee, right? So that patellar reflex is absent. Respiratory rate is 11. Okay, that has decreased below normal limits with complaints of shortness of breath. Pulse ox is 92% on room air. So this question is asking us to click to highlight the 4 findings that are the most significant. Okay, the most significant. So there's a lot that's concerning. Okay, there's a lot of things that are concerning. The blood pressure is 159/89 is concerning. The fact that there's nausea present is concerning. The fact that, let's see, the fact that there's no reflexes present is concerning. The fact that there's cutaneous flushing and sweating may be concerning, but you know that that's one of the side effects of the medication. The fact that there's shortness of breath, that's concerning. The fact that there's 20 mLs of urine is concerning. So there's a bunch of things that's concerning about this patient. The fact that their blood pressure has dropped so low is also concerning, and that's not necessarily so low, but has dropped significantly from what it was before. So these are some examples of some of the things that you may or may not find concerning with the patient. And as new nurses, right, we are concerned about everything, okay? But we have to choose the 4 things that are the most severe. If we do nothing about, bad things can happen to the patient. Okay, so take some time to think about it or pause the video to let me know what you think before I go over the answers with you. Okay, so hopefully you have stopped the video and took some time to kind of think it through on your own, maybe read through the case study again and understand what's going on with the patient. So there's quite a few things that are concerning, but the top 4 things that are concerning about this patient is the fact that there are no reflexes present. That is a red flag that tells me that there's magnesium toxicity. The other thing that is concerning, oh, I didn't highlight it initially, is the fact that the respirations are 11. That is below the normal range. Normal respiratory rate for adults is 12 to 20. The fact that there's only 20 mLs of urine is concerning because that magic number again is 30 mLs of urine per per hour. Now, cutaneous flushing and sweating, we know that that's a side effect of magnesium sulfate, so that's not the top four thing that is significant. The shortness of breath is going to be the fourth thing that really causes me to say, okay, I need to do something about this or report this. So the four most significant findings are the fact that this patient that's on magnesium sulfate doesn't have any reflexes. Their respirations have decreased to below a normal range, which is 11. Their urine output has decreased below a normal range, and they have shortness of breath. So when I think about this, the rationale for choosing those four answer choices is that magnesium toxicity is characterized by respiratory depression, decreased urinary output, and loss of deep tendon reflexes. Cutaneous flushing and sweating are expected side effects of magnesium administration and are not concerning. Okay. Blood pressure at 0,900 is expected since the client has severe preeclampsia. Magnesium infusion can cause hypotension. Okay, so that is question 1 of the 6 questions. Let's go to question 2. Okay, so with these questions, always look to see if there's a new note, if there's any lab values, anything has changed. So 845 note is the same, the flow sheet is the same, the notes below are the same. So this question is asking us, what additional assessment data should the nurse obtain? So remember, we always think in terms of ADPI, okay, ADPI. So what else do we need assessment-wise? Do we need to know the fetal status, breath sounds, the pupils, level of consciousness, sensation, capillary refill? So this is a select all that apply, and you're going to say, okay, what do I want to know more about? Pause the video and think about it, and then come back. Okay, hopefully you have paused the video and you tried to think on your own, what additional information do I need to take good care of this patient? What do I need to be a safe nurse? If you said fetal status, that is great. That should be really, after this secondary, after we make sure that the mom is okay, we want to assess the fetal status by assessing that fetal heart rate. Another thing is going to be breath sounds. Whenever a patient, med-surg, maternity patient, whenever any patient has shortness of breath, I would expect to do a focused respiratory assessment. I need to figure out what's going on with their lungs. I need to listen to their breath sounds. The other thing is we have to look at the level of consciousness. Okay, the level of consciousness should be assessed because patients that have magnesium toxicity, they can have not only breath sound changes that come with pulmonary edema, but they can also have changes in their level of consciousness. Okay, so that's going to be important. We're not worried about the pupils at this point or sensation or capillary refill. These three things, the fetal status, the breath sounds, and the level of consciousness should be additional assessment data for this patient that we suspect has had too much magnesium. She's showing the signs and symptoms of magnesium toxicity. Okay, so whenever there's any complication with the patient, always assess the fetal status. Okay, that's a big thing to do. All right, so this is question 3. We have the same information, the 845 note, the flow chart is the same, the orders are the same. So this is a drag and drop kind of question, and this question is asking us to drag one most appropriate word or phrase from the choices to fill in the blank of the following sentence. So take a minute to look at the 4 choices and think about, based on what the patient has presented with, What do you think the patient is experiencing? Pause the video and try to think about it. Okay, pause. Hopefully you've unpaused the video and you did pause. So is it a placental abruption? Based on the signs and symptoms that the patient is showing, do we think that there is a placental abruption? Do we think that it's magnesium toxicity? Is the patient showing signs and symptoms of magnesium toxicity? Are we showing signs of eclampsia? Okay, are we showing signs of eclampsia? Or are we showing signs of pulmonary embolism? Pulmonary embolism. Well, if you said magnesium toxicity, you are correct. Trends are consistent with this, the trends in the patient are consistent with magnesium toxicity. Abruption would be accompanied by uterine tenderness, vaginal bleeding, right? Fetal distress. So this is not what we're seeing. There's no vaginal bleeding. There's no fetal distress, right? So we know that this is not a placental abruption, okay? Seizures must occur in order for the patient to be diagnosed with eclampsia. There's no evidence of seizures here. And pulmonary embolism would be accompanied with chest pain. Although there is shortness of breath, there is no chest pain. So again, this is taking those clinical cues, everything we see in the patient's chart, and understanding what the patient is experiencing. And in this case, it's magnesium toxicity. All right, so if you guessed that, if you chose that, you did very well. All right, let's go to question 4. Question 4, we again want to look to see if there's any new information. Okay, all the information is the same. The flow chart is the same. And now we're going to go and we're going to look at this question and we're going to say for each potential intervention, and there's quite a few listed, these are the different interventions. Click to specify whether the intervention is indicated or not indicated. Okay, indicated or not indicated. Okay, so should we stop the magnesium infusion? What do you think? Well, if we suspect magnesium toxicity, it is indicated for us to stop this magnesium infusion. Okay, and what is the antidote for magnesium toxicity? That is calcium gluconate. Okay, so yes, it is indicated for us to administer calcium gluconate because that is the antidote for magnesium sulfate. Should we place this client in the supine position? This is definitely not indicated. This patient is far along. She's 35 weeks gestation. We know that we don't put a patient that is 35 weeks gestation in the supine position because that gravid uterus, that pregnant uterus is going to be lying on the vena cava and cutting off blood flow, and now we'll have supine hypotension. So no, it's not indicated to place that client on her back in the supine position. So activate a rapid response. Should we activate the rapid response? It is indicated to do that because this patient is suffering from magnesium toxicity. A potential crisis may occur because the vital signs and all the signs that we're seeing are going in the downward trend, okay? Should we provide this patient with oxygen? Well, yes, look at the oxygen saturation. Oxygen saturation on room air is 92%. We need to give this patient oxygen. So yes, it is indicated to provide oxygen. Should we monitor the fetus? Is that indicated or non-indicated? And I know that everybody got that one right because yes, we're always monitoring the fetus, right? Always. Administer anti-seizure medication. Well, it's not indicated at this time because the blood pressure has gone down, right? And the patient doesn't have a history of seizure. So we won't give any anti-seizure medication, okay? Okay, let's see. Draw serum magnesium level. Is that indicated or not indicated? Well, what do you think? It is definitely indicated because we suspect magnesium toxicity. The only way to know is to draw the blood, right? And the only way to confirm it positively is to draw the blood, even though in our nursing line, we know that this patient does have the signs and symptoms of magnesium toxicity. Should we check for a medication error? Absolutely. Always check for medication errors. Okay, even if you think, oh yeah, I did it fine, two nurses checked it, always. Okay, so it's always necessary to check for medication errors after medication related complications. Okay, so always check. Okay, should we elevate the extremities of this patient? Is that indicated or not indicated? Okay, it's not indicated. Elevation of the extremities is unrelated to magnesium toxicity. All right, so take a moment to take this all in. What is indicated and what is not indicated in the care of a patient that has magnesium toxicity? All right, let's go to the next question. All right, so this is question 5 of 6. Again, same patient. The admission note is the same. The flow sheet is the same. No new data. The nurse's notes are the same. So this question is asking us now, which 3 actions should the nurse take first? Okay, so this is a priority question. All right, so imagine that you're at the bedside. This is your patient. What do you do? Take a look at these choices. You can pause the video and choose your 3. Okay, so what are the 3 most important things to do? If you could do 3 things and then go home, what would you do? Okay, well, I'm going to tell you the priority actions are to get help, stop the infusion, and administer the antidote calcium gluconate. The other interventions are good, but they're not the immediate priority. So we're going to stop the magnesium infusion, administer calcium gluconate, and activate the rapid response. Some of you may be thinking, oh, I've got to monitor the fetus. Yes, you do. However, the mom is going downhill right now. So yes, we are concerned about the fetus, but the mom is in great danger. And without the mom, there won't be any fetus. Okay, so we have to, in this case, make sure that we get the mom stabilized by stopping that magnesium infusion, administering calcium gluconate, and activating the rapid response. Okay, so take a minute to take that in. And again, this is a priority kind of question. All right, we've got one more question for this patient. And as always, see if there's any new notes. And we do have a new set of vital signs at 12:15. Okay, so at 12:15, we're not giving any mag sulfate. We don't have any reflexes. Blood pressure is 108/75. Heart rate is 103, still tachycardic. Respirations, 11. So we still have bradypnea. Okay, we have pulse ox at 93% on 10 liters of oxygen. Okay, urine output is not measured, and we still have a shortness of breath for this patient. Okay, so I'm not really satisfied with those vital signs. I'm not really feeling very good about the patient right now, the outcome for the patient. Okay, so at 12:05, we see the infusion stop, rapid response activated, calcium gluconate given, stat serum magnesium drawn, fetal heart rate to 105 beats per minute with moderate variability. That fetal heart rate is not reassuring to me. It's below 110, so I'm concerned about the fetus. Client placed in left lateral position. Remember, the best position is going to be the left lateral position. That's going to not place any weight on the vena cava, and that's going to be the best position for the patient to be in. Lungs are clear to auscultation bilaterally. Client given oxygen via non-rebreather at 10 liters per minute. Okay, so at 12:10, the fetal heart rate returns to baseline. That makes me sigh a little bit of a relief, okay, that fetal heart rate is back to baseline. moderate variability, no deceleration. So that's reassuring about the fetus. 1220, the BP is 108/75, respiratory rate 11, pulse ox 93 on 10 liters, shortness of breath continues, fetal heart rate 125 beats per minute with moderate variability. Okay, so here's the orders. The orders are to stop the magnesium infusion, calcium gluconate 10%, 1 gram IV over 10 minutes. Serum magnesium level is stat. We're going to get that serum blood level of magnesium, and we'll give the oxygen via non-rebreather to keep that oxygen saturation over 95%. Okay, so those are the orders. So the nurse reassesses the client 15 minutes after implementing that treatment plan. Okay, complete the following sentence by choosing from the list of options. The nurse determines that the client's status is improving, deteriorating, or unchanged. Take it some time, pause the video, and tell me what you think. Okay, so based on what we saw with the patient's vital signs, okay, their vital signs, okay, look at the 1200 vital signs next to the 1215 vital signs, okay? We stop the magnesium sulfate and look at the vital signs, look at the assessment of the patient. Okay, so let's go back. And the nurse determines that the client's status is improving, deteriorating, or unchanged. Okay, if you chose unchanged, you chose the right answer. That is correct. It's unchanged. Now, what should the nurse do? Should the nurse request an additional dose of calcium gluconate, resume magnesium infusion, transfer patient to intensive care unit? Take a moment to think about it. You can pause the video if you need to. Should the nurse request an additional dose of calcium gluconate? And I want you to think about this. And when you look at the answer choices, ask yourself, this is a test taking strategy, ask yourself, if I was to do this, what would the outcome be? If I request an additional dose of calcium gluconate, would that help the patient? If I resume the magnesium sulfate infusion, would that help the patient or would it harm the patient? Is it warranted for me to transfer the patient to the intensive care unit? Okay, so take a moment to think about it and select your answer. And if you chose request an additional dose of calcium gluconate, you chose the correct thing, because calcium gluconate is the antidote for magnesium toxicity, and it can be administered more than once if there's no improvement in the client's condition. So the client has not improved, and magnesium sulfate infusion would be contraindicated. If you were to give magnesium sulfate to your patient, yep, go ahead. You might as well transfer them to the ICU, okay? Because they're going to end up going there if you give them more magnesium sulfate. So please don't choose that answer, okay? And transfer to the ICU is not warranted at this time, but if you give more mag sulfate, they're going to make their way to the ICU, which we don't want. So we can request an additional dose of calcium gluconate. So those were our 6 questions, and this was actually a preeclampsia case study. I didn't want to tell you in the beginning, but now you know, you probably figured it out. This was a preeclampsia case study. Thank you very much. Have a great time studying.